and obviously with prescription drugs, it's so much. It looks like they're just going to take a pill, or it can happen so fast.
In a recent study, 1 in 7 teens admit to abusing prescription drugs to get high in the past year.
What actions do you take as a counselor to prevent prescription drug abuse in our school?
Well, as far as preventing it, I think the things I would say that we do is really to try to help students have a balanced academic calendar as well as social calendar. I think from what I understand, part of the thing that leads people to abuse prescription drugs is just like being totally burned out, and totally stressed out. And so if we can help people achieve that healthy balance in the first place, hopefully that will prevent them from getting involved with that.
If a student comes to you and asks for help with their drug problem, what do you do with that, and are they still in trouble? Is there still punishment for that?
Yeah. Typically if they come to see me about it, there's not really going to be disciplinary consequences. I would get the parent involved if possible, and then again, kind of assessing the situation. There are resources within the community that we can get the student involved in to provide them some support in breaking that habit.
My answer is, if they're taking it, using, then we follow our handbook for drugs. It's just like having marijuana or whatever it might be. And so it could be anywhere from a 5 to 10 day suspension. It could even be an expulsion.
The addiction to drugs is a difficult thing for any individual to deal with. Often addiction leads to the decline of a person's well-being, financial security, and health. Drug addicts have a hard time keeping a job, their families, and sometimes the addicts find themselves either in trouble with the law or homeless on the street.
I would describe prescription drug abuse as using any medication not prescribed to you or using it in a way other than it is prescribed to be used. Absolutely. I see every report where we are charging someone with a different crime. I see numerous reports where someone stole a prescription medication, committed prescription fraud, trying to get more from a pharmacy, stole something to get money for more, or drove under the influence of a prescription medication. Dealing is always a felony. The number of years in prison varies depending on what is being dealt. The low end is usually 2 years. Illegal use of a controlled substance is a year misdemeanor. Even giving away a controlled substance is a 90-day misdemeanor. Education is an absolute must. Whether a particular individual listens or not, accurate information must be provided as a tool to help you make decisions. Also, let me say to you that everyone must be realistic and take steps to protect their medications. Everyone should keep their medications locked up, as an adolescent is most likely to get them by stealing from immediate family members or maybe extended family or even friends. And parents need to be involved in their children's lives and pay attention to things that just don't seem right. I think there needs to be a combination. Punishment provides many people with incentive to not do something or to not do it again, and we need to hold people accountable for their actions. However, punishment by itself cannot treat an addiction. A person needs professional counseling for that.
My name is James LeRae. I'm a licensed master social worker. I'm also a certified advanced addiction counselor and nationally certified gambling counselor. I'm an outpatient therapist in Okemos, and my private practice is the Center for Addiction and Relationship Recovery. Basically, drug abuse is when somebody feels that they need to use a drug to make it through the day, to get through a specific emotional event and experience that normally they wouldn't have to do. Absolutely. It's a totally common problem. Way back in 2005, I worked at Albion College, and I worked with college students specifically related to drugs and alcohol. When it came to the drugs part of it, Adderall was really very common at that time, and I think it is common these days as well. Anything to help somebody stay awake, to improve their grades, to pull an all-nighter, something like that, I know it is quite popular. Depending on the statistics that you read, about 20% of adolescents or teenagers will admit that they have problems or they've used prescription drugs outside of a prescription. Is I give them a full assessment, and I ask them many questions about what's going on in their life, what specifically is the reason that they're coming to see me. Usually they'll come right out and say that they have abused drugs or that they have problems with drugs in some way. But once I make an assessment of how severe the problem is, then I determine what level of treatment will be what's called the least restrictive. You know, we don't want to send somebody to an inpatient hospital for drugs if the problem isn't that severe. But I work in this office on what's called an outpatient level, which is the least restrictive level of treatment. I usually meet with somebody once a week for an hour. So if I feel that we can successfully help them in that frame of time, frequency, then I do that. Sometimes people need a higher level of care, which is called intensive outpatient, and that's usually meeting 3 times a week for 3 hours at a time. And if that's not enough, they can go to what's called a day treatment program, which is basically all day for 8 hours a day for a week or 2.
All right.
And if that doesn't work, then they can go somewhere 24/7. Absolutely, absolutely. You know, if somebody breaks the law, however they do it, you know, there may need to be some consequences for that legally. But addiction, whether it's drugs, alcohol, gambling, whatever, it's an illness. It needs to be treated as such. It needs to be respected as such. And absolutely, treatment is very important.
The average cost for 1 full year of drug maintenance treatment is approximately $4,700 per patient, whereas 1 full year of imprisonment costs approximately $24,000 per person.